Oh, hi there. How are you doing? It's good to see you today. I've just been checking on the computer and I see you've been referred as you have a couple of problems with your skin at the moment on your face. Yeah. Well, you've come to the right place. Obviously, your GP felt that it was something that we needed to take a further look at. Yeah, doesn't mean to say it's anything serious. It's just that they would have felt that we were the best people to take a close look at it because we have better light and equipment to check these things. Okay. Right, I've checked on the system and you've had some blood work done and all that is absolutely fine, so that's good. That's not indicating to us that you've got anything else untoward, like an inflammatory condition going on. Yeah? Okay. Well, before I get started checking your skin, is it okay if I just do a quick general check? Just check your breathing and have a palpate of your lymph nodes. Yeah. Okay, bear with me a second. Okay. I'll just warm this up for you. Okay. So I'm just going to pop this on your chest. Okay. And take a nice deep breath in for me. And out. Okay. And in. And out. Okay. And in. And out. And in. And out. Okay. I'm just going to hold this onto the chest just to check your heart rate, okay? Well, everything sounds normal there, that's good. That's what we'd expect to hear. Okay. So you've not had any recent infections or anything like that? Okay. Well, your bloods certainly don't show any infections, so that's good. But you've not got a cold or... Okay. It's just worth knowing before I check your lymph nodes because lymph nodes, obviously, they'll react to infections. So you would expect to find them maybe swollen a little bit, particularly around the throat area and ears, if you've got something like a cold or a sore throat. Okay. So I'm going to start by palpating the lymph nodes in your neck. Okay. Okay, and under your chin. Okay, I'm just going to go around the back of your neck a little bit, okay? And just onto your collarbone, all right? Okay, everything seems fine there. Okay, just okay just to open your mouth for me. I'm just going to have a little quick look down into your mouth area. Okay, I'm not going to depress your tongue, I don't need to do that, but just open wide for me, stick your tongue out and just say "ah" for me. Okay. And "ah" again. That's fabulous. No problems there. Okay. Well, I'm happy with that. So you seem all fit and well as far as that is concerned, and your blood work, so we're okay there. The referral is telling me that you've got a patch on your forehead, just here, which I can see, and also you've been suffering from some redness and swelling across your nose. Yeah, I can see that too. Has your GP explained what it might be? Yeah. There's a strong possibility that it is rosacea on your nose, but I will take a closer look at that for you. But first, what I'd like to do is do a general skin examination of your face, if that's okay with you. Yeah, it just helps me get a clearer picture of everything in this area, and I can also just check to make sure that there's nothing else untoward going on as well, whether you've got any little moles or any hyperpigmented lesions, areas, anything like that. Okay. All right, so just relax. Nothing I'm going to do is going to be painful. Okay. So I'm just going to start by looking up on your forehead. Okay. Just having a little move around. Okay, look the forehead on this side. Okay, just under the eye area there. I'm just going to come a little bit closer to you. Okay, just round the eye a little bit there. And on this side, just round the eye. Okay. Okay, let's just have a look on your right cheek here. Okay, well, your skin seems really supple and nice. It seems well hydrated. Just a little look round there on the chin area. Okay. Yeah, I think that's looking pretty good. So what I'll do now, I've got a light and I will just be shining the light onto areas of your skin, and I'll be looking through the magnifying glass, and that will give me an even closer, detailed look in the areas that may have a little bit of concern. But I'm just going to look at the area that you've been referred for, this area up the top. I'm pretty sure I know what this is, but I'm going to have a close look now. Okay, with the light. Yeah. Okay. I'm just going to come down and have a little look on this area of the nose. Yeah. Okay. Right, that's certainly looking like rosacea across the nose area there. Let me just have a little look over here just to make sure. But I think things are fine there. Okay, now I've got a different type of light now. It may have a slightly blue shine to it. It's only very subtly blue, but it just lets me look at things in a slightly different way. Okay. Okay. just check this side. Okay, now just check across your nose with this one. Okay. Right, that's super. So, I think what I'm going to do with the area on your top right here, it looks to me like that is an actual fungal infection. It's nothing to worry about, it can be easily treated, okay, but I'd just like to take a little sample of that if that's okay. We can get that tested very quickly, the results will be back within 24 hours, but I'm pretty sure I know what that is, so I'll get that checked now for you, okay. Okay, so I have a little sample pot. Okay, just bear with me while I do this. That's not uncomfortable, is it? No, okay. Okay. Okay, so that will go off to the lab and we'll get the results to you quickly. We will give you a call with that one. Okay. Now while we're here, is there anything else you'd like me to look at? Right, okay. On your chest area? Right. Okay. Well, just bear with me. I'll change my gloves and we'll have a look at that for you, okay? All right. Okay. I'm going to pop a clean pair of gloves on now just to check a different area of your skin. Okay. So I'm just going to open the gown a little bit there. I'll just check this skin for you. Okay. I'm just going to pop my light on that. And we'll have a little look down at that as well. Okay. Yeah. Is it sore there at all? The spots feel sore. Yeah, they do look a little bit inflamed, to be honest. There's a couple of quite inflamed ones there. Yeah. You don't pick them at all, do you? I know it's tempting, but try not to, because it can really just spread the infection and you'll end up with a wider area of these sore spots. That is actually acne that's on your chest. Yeah, it's quite a small area, but they are quite bumpy, aren't they? Look a little bit cystic in a couple of areas, so but we can get you something for that. Okay. Have you had any acne treatment before? I can't see on the system that you have. No. Okay. Do you have any on your back at all? No. Okay, that's fine. So it's just the chest. Okay. Do you tend to sweat quite a bit? Yeah, because it could be to do with the heat makes it worse a little bit as well. But we'll give you something for that. Okay, just bear with me because I'm just going to make a few notes on the system. Now your GP's done the right thing by referring you, because we can look at everything related to your skin here in dermatology. That's what we're here for. And there are even some medications that your GP couldn't prescribe anyway. Not that you'll be needing those today, but they can only come from a consultant dermatologist. Right, okay. So, as I've said, this top area is a fungal infection. It's a brownish fungal patch. I have sampled it, as you know, so that will get confirmed, but I can tell by its appearance and the way it's flaked that it's a fungal patch, and we can sort that for you. I'll prescribe you something called ketoconazole cream for that, and you'll probably need to use that once a day. Use it for up to 4 weeks. Okay, I will get you back anyway for another appointment to check that, so we can do that for you. Okay, and now moving on to the nose area and across your face here, and I notice there's a tiny bit on your forehead as well. That certainly does look like acne rosacea or rosacea. Do you get any sensations before it tends to flare? Yeah, so it feels like it's itchy and tingly and sometimes a little bit like sunburn. Yeah, just gotta look around the side a little bit more there. Yeah, I'm not gonna touch it. Yeah. Yeah, it typically does spread across the face. As your bloods are really good, I'm not concerned that there's any other inflammatory illness going on there which could cause a similar rash across the face, so I'm not worried about that at all. Do you get the little papules? Yeah, you do get the bumps. Okay. Yes, I can prescribe you a cream for that as well. I'll give you some metronidazole cream to pop on that twice a day. Unfortunately, we don't really know what causes rosacea. It's still a bit of a mystery to us, and there isn't really a cure that we know of. It's more a case of trying to keep it at bay, trying to keep the flare down, and avoiding things that can trigger the flare. Yeah. Have you noticed anything in particular? Okay. Yeah, sunlight may trigger it. Okay. And alcohol. It's quite well documented that alcohol can actually trigger the redness to flare. And also, believe it or not, eating spicy food can do it as well. So try to avoid, obviously we can't avoid the sunshine all the time, but try and avoid drinking alcohol or spicy foods and see if it does help it. I mean, they're not the only things that can trigger it. Even changes in weather can trigger it, but I can certainly see that's what that is there. And we'll get you on some cream for that. And we'll have another look at it when I ask you back in about 4 weeks. Okay, now moving on to the chest area. Because you haven't got a widespread area of acne, I don't really want to put you on an oral treatment like an oral antibiotic just yet. I'd be more inclined to give you a topical solution for that. I think what I'll try you on first, rather than an antibiotic, I will try you on some benzoyl peroxide, on a milder one, something like a 5%. I don't want to burn your skin and put you on a stronger strength straight away, because it can be uncomfortable. So just apply it at night time in the area, but do be mindful that it can bleach fabrics. So when you pop it on, just wear an old t-shirt or something. Try not to get it on your bedding, because it actually can bleach. And you may find that should calm down within a couple of weeks. It may go a little bit dry, but we'll monitor that again when you come back. Is that okay? Do you have any more questions for me? Right, okay, that's fine. If you're happy, I'll write you a prescription, and I'll get in touch with reception now on the computer, and they'll be able to book you an appointment for 4 weeks' time. Okay, so I'll do that now. You can come to this clinic here, can't you, in 4 weeks again? Yeah, that's fine. We do have another clinic, but it's a little bit further away, so I thought you'd be better off coming here. Okay. Right, bear with me, I'm just going to write out your prescription. Yes, you can get this from the hospital pharmacy, yeah. That's fine. Okay, so you've got the 3 items on there. It will tell you on the packets what they're for, so don't worry, you won't get confused. Okay, and obviously all the dosages are on there and how many times to apply. Okie doke, I'll just pop that for you. Okay, so there's your prescription. Okay, super. Okay, so if you have no more questions for me, I will see you again in 4 weeks. In the meantime, if you do have any problems, or anything else seems to pop up on your skin, or you're having any reactions to the creams that I've given you, then please do call the secretary. The number is on your appointment card, and then she will pass a message on to me. Okay, and I can give you a call if needs be, but hopefully you'll be fine, and I'll be able to see you again in 4 weeks and back in this clinic. Okay, it's lovely to see you. Take care now. See you soon. Bye-bye.